Hello everyone, my name is Gabriela Narciso and I want to thank you all for being present here today to be able to listen to my presentation, which is labeled as Pregnant Prevent Pertussis, Get Vaccinated. My presentation is based off of evidence-based practice research over a clinical question I have developed. So let us begin. So my PICO question is, in pregnant women, does the use of the Tdap vaccine reduce the risk of an infant developing pertussis during the first 2 months of life compared to pregnant women who do not receive the Tdap vaccine? The way the question was formulated was I use an intervention template, and that's found in the Mylick and Finet Overholt textbook that's in my references. So I made sure that all my PICO components were there. So first we have P for the population, which is pregnant women. I for intervention is the use of the Tdap vaccine. C for the comparison intervention is not receiving the Tdap vaccine. O is preventing pertussis in infants, which is the outcome. And T, the time frame, which is in the first 2 months of life. So now that I have created a good PICO question, this will guide me in searching the database and locating evidence to answer my clinical question. So next slide is locating my efficient evidence. So the database I used was the Cochrane Library, and my article that I found was the safety and immunogenicity of tetanus, diphtheria, and acellular pertussis immunization during pregnancy in mothers and infants, a randomized control trial. The database I used, as I mentioned, was the Cochrane Library. And the search terms I put into the search engine were pregnant women prevent pertussis and Tdap. But I also put a limit to it, and as you can see on the left side, there's a limit and there's trials, so I clicked there, and to my luck I was able to find this great article. And take notice of the year. It was published in 2014, which is, better because it's more recent, and recent evidence is always better. So next, when I read my article, I wanted to review the evidence. So I broke it down between its strengths and the weaknesses. So we first have the strengths, and there were no cases of pertussis. There was a higher concentration of pertussis antibody in infant and the mother. So that's compared to pregnant women who didn't receive the vaccine. And those infants born to mothers with the vaccine still had a higher concentration even at 2 months of age. Also, the findings suggest that third trimester maternal immunization is more efficient. And that is because there was efficient placental transfer of the antibodies to the fetus. The weaknesses I found in the article were that there was a small number of participants. So those who received the vaccination were 33, and the placebo sample size was 15. To be able to repeat the study, we need a larger sample size, and that has to be done in order for us to really ensure that this is good evidence we're able to use in our patients later on. Another weakness was that the antibody concentration after the first dose was not measured, but even though it wasn't measured, we were able to still see that the infants had a high concentration of antibodies still at 2 months before they received their Tdap vaccination immunization schedule, which is a weakness that it wasn't measured, but we noticed from our strengths that they still had a high concentration. And the study was not designed to evaluate the efficiency of vaccination for mother and infant. even though it wasn't designed, the results still indicated that pertussis was not identified in any of the patients, and they didn't get sick, which is good. So now we go to the placement of hierarchy of evidence, and we'll see where I decided to place my article. So as you can tell, I decided to choose a level 2 because in our title it says it's a randomized control trial. It was a randomized blind placebo control trial, which is excellent, and that's level 2, which is the gold standard when it comes to research. So to be a randomized control trial, the study has to be an experiment. And how do we determine if the article was an experiment? Well, it has to be broken down into a treatment group and a control group. And we did have that. We had a treatment group which received the immunization, and we had the control group which received the placebo. And also, the randomization was done by stratification. And in this clinical trial, the stratification was that each participant was stratified by site, and they were given a random block size. So this randomization decreases any chance of bias. Next slide, I will critically appraise this evidence. So we will begin. So I used the critical appraisal principles of validity, reliability, and applicability. And those principles I found also in the Meinlich and Feine Overholt textbook that I have in my references. So first, I will begin with appraising validity. So the validity in the article was that it was a randomized double-blind placebo control trial. So that increases the study strength because it's randomized and decreases any chance of bias, like I said earlier. The population was made up of healthy pregnant women and singleton pregnancy women, usually around 18 to 22 weeks because they wanted to do it during the 3rd trimester. The women were randomized 2-to-1, so that was broken down into 2-to-1, meaning that one receives the placebo and the other receives the Tdap vaccine. Like I said earlier, randomization was stratified by site, so that means that the participants were, given each a block size, and they were assigned a unique treatment number that corresponded to the treatment allocation. Also, the subject and providers were kept blind of the study, except the person who was administering the vaccine. Next is reliability. So, with reliability, we have the results, which was a 95% CI, which is good, and the p-value was a 0.042. So if your p-value is anything less than 0.05, it indicates a strong evidence, and it indicates that it was done by randomization and there wasn't anything that mimicked it. So as you can see, our p-value is a 0.42, so we have a very strong result there. Reliability, another one is the higher concentration of antibodies in women and their infants who received the Tdap vaccine. So they had higher antibodies at birth and at 2 months compared to those infants whose mothers did not receive the vaccination. But we still had that limitation, which was the sample size. That was the only negative thing about this trial, but it still had really good results. So now we look at applicability. So for applicability, I first wanted to take a look at the outcomes and how they were measured. And the outcomes were measured, at 4 weeks after the vaccination was given, at delivery, at 2 months, and at 4 months postpartum for the infant and the mother. And what we saw there was that they still had an increased antibody concentration in their blood. So that means that there was a good effect of what was given. And I also wanted to look at the benefits that we saw from the trial. So the vaccination, it elicited the immune response that was desired, and we saw no adverse effects. So for the patients, that's great for them to see, but also for us as the nurses or doctors who are, advising their patients whether or not this is a good immunization for them. Before, for applicability, we have to see, is this feasible in a clinical setting? And I believe it is because, from what we saw in the results, they had positive results. It showed that the immunization was eliciting the response that we were looking for. So is it feasible in a clinical setting? Yes. And I believe, any patients that go into the OB and ask for this and, have questions about it, I think, this is a good vaccination for them. So is there a change in practice in what we do? I wanted to compare it to what I saw in the Canadian Family Physician article I have in my references, and they stated that in 2013, the Center for Disease Control and Advisory Committee of immunization practice, they revised the schedule from what it was previously, and that was just that women who were pregnant only had to get the vaccination once in their life. But now, they revised it, and now you get the Tdap vaccination before every pregnancy. Our article also supports this. They support also that it should be in the third trimestral maternal immunization should be given because of the results they got from their study, which, was that there was an efficient placental transfer of the Pertussis antibodies, concentration in infants' cord blood, and also in the maternal serum. So we still see that high antibody concentration. And also, the article I found is an RCT, randomized control trial, level 2. It's the gold standard for research. So I very much support the change in practice for this vaccination for the Tdap. The research provides evidence for improving the protection of mothers and their infants. And as a nurse, my priority is in, the safety of my patients. So thank you very much for listening to my presentation. And here are my references. So if you have any questions, please let me know. Thank you.